Good evening, everyone. Some of you may know me, but those who do not, I am Robin Shepard. I am head of clinical at Vidance Medical in the US and your host for this evening. I have worked in aesthetics for a decade, and I have been a clinical trainer for energy-based devices, working under Dr. Eubanks for the last 5 years. The agenda for this evening will be introductions, a brief overview of the science behind our hand Pico, an exciting announcement about our new FDA clearance, a panel discussion showcasing their personal cases, their before and afters, and how they integrate our hand Pico and other Vidance technology into their practice, and we will conclude with a Q&A. Should you have a question during our presentation, please put it into the chat, and we will do our best to get to all of them at the end of the presentation. I'm so excited about this online seminar, specifically because we have a truly stellar panel tonight. Allow me to introduce you to Dr. Joel Cohen, Dr. Valeria Campos, and Dr. Gardenia Palomino. Dr. Cohen is a board-certified dermatologist and an internationally recognized expert on aesthetics. He is the director of About Skin Dermatology and Aesthetics, as well as director of research based in Denver, Colorado. He was named top doctor by U.S. News and World Report, and he has recently won Faculty Teacher of the Year at the University of California, Irvine, where he is an associate professor of dermatology. He has been quoted in Vogue, Time, Glamour, Allure, and the New York Times. Dr. Cohen, thank you so much for being here tonight.
Thank you.
Dr. Campos is a dermatologist who became a research fellow in dermatology and laser at Harvard Medical School, graduating in 1999. Dr. Campos has published 2 books as the main author. The first, Laser and Other Sources of Electromagnetic Energy in Dermatology, in 2007, and the second, Drug Delivery in Dermatology, in 2018. She holds several titles in the United States, including Specialist in Laser and Dermatology by Harvard Medical School and Specialist in Laser by Massachusetts General Hospital. Since 2011, Dr. Campos has worked as an assistant clinical professor at the Department of Dermatology at University Hyundai. Thank you, Dr. Campos, for being here tonight.
Thank you.
And Dr. Palomino is a board-certified dermatologist specializing in laser treatments and advanced dermatological technologies. She received her dermatology specialization at the Laura de Souza Institute in Lima. She is a specialist from the Brazilian Society of Dermatologists and CEO of Gardenia Palomino Dermatology Clinic in São Carlos, Brazil. And she has been an excellent teacher and mentor to me as well. Thank you, Dr. Gardenia, for being here tonight.
You're Robin.
Okay. So fundamentals of picosecond lasers. So what I love, we've all seen target absorption curves before, especially for our 1064. And what I think is so cool about lasers in general is you can take a wavelength that's known for how deep it can go into the skin, and just by manipulating the pulse width, it will behave completely differently once applied to the skin. And we manipulate that pulse width to work in nanosecond and picosecond. So it's an extremely short pulse duration. 1064s normally operate in a long pulse, which is a millisecond, which is still 1,000th of a second, but it's still considered a long pulse. And that's for hair removal and vascular lesions. And then when we change it to a nanosecond or picosecond, it changes to be really wonderful for tattoo and pigmented lesions. And nanosecond is a billionth of a second, and picosecond is a trillionth of a second. So very, very short pulse width. Now, what does that look like in skin, or how we apply it to tattoo removal? A lot of providers, especially when they have a dark tattoo, like to start in nanosecond, and it likes to blow pigment. And someone once said it's kind of like taking a boulder and chipping it away into rocks. And then when you do picosecond, it's taking those rocks and making it particles of sand. And all of this is accomplished with no thermal effect in the skin. It's all photoacoustic. So how that works, we use that photoacoustic mechanism of action. We're actually blowing pigment particles underneath the skin. There's a process called phagocytosis, where our macrophages from our immune system attack those fragmented chromophores, and we process them through our lymphatic system. So what we're really excited to announce is that recently, at the end of December, we had a new FDA clearance for a fractionated MLA tip for our Pico. Now, what does that look like? So most of you who have our Pico already have been using our collimated and focused tips for tattoo removal and for pigment. This is a fractionated lens, and we say MLA, that stands for micro lens array. It's a 6x6 square spot size, and it is fractionated versus collimated. So, okay, so it is our square spot size. Like I said, the MLA stands for micro lens array, and it has 280 microthermal zones. There is a concentration of the pulse's total energy into microzones, generating a very high energy. Okay. So what the MLA tip can do is form something called LIOBs. So there is a concentration of the pulse's total energy divided into the microzones, generating a really high peak of power. The energy accumulated by this laser ionizes the molecules until plasma is formed. This plasma ball, through electromolecule collision, generates intraepidermal vacuoles, or they look like these little bubbles, as you can see in that illustration, in the papillary dermal layer. Once these break, the LIOBs, and LIOB stands for laser-induced optical breakdown. This stimulates an inflammatory response, leading to collagenesis, and all while not stimulating any heat in the tissue. We get asked a lot how our hand Pico compares to our competitors, specifically when it comes to the fractionated tip. So you can see the hand Pico is first. The depth and the size of those LIOBs are very comparable to any of the other Picos on the market. And the question we also get is, what does the skin look like after a microfractional Pico toning treatment? And that just depends on you. So you can do really mild microfractional Pico toning, or you could do something called intense Pico, which I have pictures of both. But it results in this petechiae, or a little bit of purpura, but we're not disrupting the epidermis, so you can cover with a tinted sunscreen right away. So this is a mild microfractional picotoning treatment. You can see the model after 1 hour, what the skin looks like, and you see it mostly around the eyes really start to develop. But even day 1, it's significantly reduced. Day 2, it's almost normal. And by day 3, she's pretty much back to normal. But I did feel like it was important to show what an intense Pico can look like. And although this might look kind of scary, this is a very normal response. When we're using this high of energy and we're accumulating that many shots over the face, you will see a good amount of purpura develop. But you can see just after 5 days, the skin is almost back to normal. And I like to point out that this is a darker skin type. Okay, so now I'm going to turn it over to Dr. Cohen to lead the panel discussion.
Good evening, everybody. It's great to be here along with Dr. Campos and Dr. Palomino. I've been using the Vidant Xi now for almost a year, and really it's integrated super nicely into my practice, and we use it routinely for many of the things that we're going to discuss tonight. So we're going to present a few cases for some of the common things where I think that this laser really shines. So first, in my practice, I think some of the low contrast lentigines are the #1 use that I use. So patients frequently come in, they've been treated with intense pulse light in various practices or spas, and they get to a point where they're not seeing improvement per session, but nevertheless, they still see spots on their face and they say, what can I do? So I think the Pico and the Q-switch really shines because these low contrast lentigines really can respond very nicely. So we have with the hand Pico, the 5mm and the 3mm spot size for both the 532 and 1064. A common referral that I get, as we show here, is cafe au lait macules. So this is a great area for us to treat that other types of technology doesn't do as well, by using Q-switch and Pico on the hand Pico. And by breaking up these particles, as Robin showed, really we're able to use the hand Pico with the Pico settings to get down to a point where these particles are smaller and smaller that can be cleared with the lymphatics. And then next slide. So multicolor tattoo is a common referral. Some people who've been treating tattoos for a while really, they understand that the limitations of some of the Q-switch technology and multicolor technology, and being able to integrate the different wavelengths and the different spot sizes and being able to treat these really effectively with picosecond technology, where you can really change between the hand pieces very, very quickly. So changing between 532 for the lighter areas and 1064 for the darker areas is instantaneous. You just pop in the other tip and you're ready to go. And that's one of the things that I like most about this technology. We're able on the fly to add this technology. The laser turns on super quick, it calibrates very quick, and within a minute of turning it on, you can actually be treating a patient. And then next slide. So, and then really exciting, and my colleagues, Dr. Campos and Dr. Gardenia, they have some really, sorry, Dr. Palomino, they have some really impressive pictures of improvement in melasma, and especially in patients who have type 4 skin, which can be very challenging. But having the flexibility to use the pico technology and having the 7mm spot size so we can do pico toning is really helpful. And now the micro lens array, we can go over these areas. And a lot of times I'll use the 7mm over an area that I've treated really on low settings overall, and then use the 6mm, the fractional array, to treat these areas as well. So I think these are really common things that we all see in our practices: low contrast lentigines or lentigines overall, and then melasma. And then sometimes we get these referrals for cafe au lait macules and these more complicated tattoos. So, and then the one thing that we didn't talk about here, but we're going to have some examples, is another common referral is nevus of Oda, that they have a lot of experience on. So does anybody want to talk about how you guys really integrate hand pico into your practice?
Nowadays, the hand pico is the #1 laser, the most used in my clinic. Like when I do research, I ask my resident, use just the day that Friday I don't work on a clinic. So the day that I allowed to use it, because I use a lot, I integrated a lot. It's an excellent. And I did, like I was mentioned before, because we did a study treating like facial skin type 1 to 6, and my patient did it was 660 treatment, not one single case of side effects related to the hand pico. So it's an excellent, as I'm gonna show good results. I hardly recommend for those who didn't already have it. Excellent.
I agree with Dr. Valeria Campos. I have been working with Pico for 2 years now, and it's easy to talk about because it's the handpiece I use the most too. And I combine with the other hand pieces, but I try to use in some cases that we are not treating pigmented lesions. I use hand pico to treat rosacea, poikiloderma, rejuvenation, and I use it in practically all my protocols. It is the handpiece I use the most. I totally agree.
I think one of the things about having the flexibility with a Q switch and a pico laser integrated into one laser is we always talk to patients about neocollagenesis and stimulating collagen. And in my fellowship, I spent time with Harvey Louie up in Vancouver during the year with the Carruthers. And Harvey published in 2008 in Lasers in Medicine and Surgery, really the fact that Q-switch lasers are not seeing water. They're really penetrating into the skin, and you're effectively able to induce collagen without a lot of heat, and being able to induce collagen type 3 and a little bit of collagen type 1. When we're doing these pigment treatments and we're using the 7mm 1064 or the 6mm micro lens array fractional technology, we're not only affecting pigmentation, but we're also stimulating collagen. And these are really good examples to talk to patients about, because patients are coming in and they may have background pigment, they may have melasma, but they also want their skin to look better. And by reflection of the fact that they've had enough sun exposure to cause the pigmentation, they certainly have had sun exposure creating other issues, whether it's early lines and wrinkles or laxity. And then acne scarring is a tough one, and having the microlens array has been very helpful in my practice, integrating it with the 1340 Pro Deep from Vidance as well has been really fun and effective for our patients. So, you know, when you guys are taking care of these patients and you're explaining the platform that you're using and how easily adjustable it is, approaching the patient like this young patient here with acne scars, milder acne scars, but nevertheless quite apparent and can cause a lot of psychological disturbance. How do you guys approach this?
I totally agree. I totally agree. I do similar to you.
And
Me
I
too.
showed, you know, although we do a lot of radio frequency microneedling in our practices, and we do a lot of ablative technology and ablative fractional technology, I think having the microlens array has been really helpful. And I show patients a lot of times on myself, and I showed patients today where, you know, really you start with your overall setting and sort of figure out the point that you're going to get purpura, and then you're just like slightly under that. So you'll have like this little subpurpuric, you may have a little bit of purpura, but patients, they see that reaction, and Dr. Campos has some good pictures of that. They see that reaction, they know something's going on, and then they start to sort of pay attention to the cumulative effects with treatments, because some of these kids are concerned about going back to school the next day or even on a weekend and their plans for the weekend. It's just nice to have something to offer that is fractional, that they'll see something happening to the skin during that little treatment, and then prolonging the time that, you know, they need to do. Eventually they'll do RF microneedling or some ablative fractional as well.
So do you know what I tell the patient? Because I do have like a ablative, and I'm kind of aggressive person when I'm treating. But with the Pico, it's easier you cover. So I tell them 2 days, like the day that I do, because I'm a firm believer in the drug delivery. So I avoid the makeup on the first day. But after 24 hours, I allowed them. It's easier to cover, because when you use ablative, if you try to cover, make it even worse. So it's another reason they'll tell them the Pico is better. It's easier to cover, to go back to their regular life.
And now there's a couple sunscreens in the US that actually are really post-procedure sunscreens. There's one.
Yes, yes.
from,
Here too, we do have it. Yeah.
That's great. All right, so I'm gonna just show, so this is a patient that had gastrocnemius implants. So basically he wanted, you know, more definition of the calf area. And he was treated with pulse dye laser a few times by somebody else, and came to see me and said, hey, like, what's going on? I'm not making that much progress here. And I looked at this, and, you know, you can look there and you see that that's not just like something from a scar that's red. There's definitely hemosiderin there. So in this case, I did the Pico 532. I started with the 5mm handpiece and just going over this area. And this is 2 treatments, and we can see really significant improvement. So, you know, the pulse dye laser wasn't all that effective because it really wasn't able to capture the hemosiderin here. So integrating really the 532 Pico, hand Pico, into my practice for situations like this, where scars, where you can make a really significant improvement in these patients and help them out, and oftentimes not that many treatments, and there's no downtime. You know, basically it's going to look a little bit darker for a few days and then just sort of recover. And these patients oftentimes do this well, this quickly, and you can see it's hard to even see the scarring at this point. So next patient is, you know, cafe au lait macule. As I alluded to, this is something really common. And this shows, you know, an issue that we all have in our practices where, you know, if it's not on the face and we're using like a standardized camera system like the LifeViz or the Canfield Vizia system, when it's on the body, it's really hard to capture the lighting, even if positionally you're trying to line things up. A little bit of, you know, the head back may be in the shadow. So I apologize, this isn't a perfect lighting picture, but I think you can get the sense of this person's cafe au lait macule on the back is quite a bit improved with a couple treatments, also using the hand Pico. And in this case, it was the 532. And what's nice is, you know, I oftentimes start with the 5mm hand Pico, and I get to a point, and then, you know, sometimes in smaller areas, I'll use that little bit more aggressive 3 mm to be able to reach a point. But I'll show you how I did some test settings on the next slide, where I just sort of drew with the white chalk around the area, and then in my little handwriting, I represented what my settings were. And then I like to kind of see what the response is and how much erythema that I get there, because, you know, obviously we want to see a little bit of whitening of these areas, but sometimes it can be so that degree of erythema, and just being able to track somebody's improvement so that next time you can see which settings were more effective and go up accordingly. So next slide. So this is, you know, typical amateur tattoo, just a couple treatments, but you can see improvement really quickly by integrating not only the Q switch, but also the Pico 1064 on this amateur blue greenish type of tattoo. And next patient is a realistic example of, I often will use these technologies like the hand Pico in conjunction with other technologies that I've had in my practice that patients may come to expect. So some of these patients, I actually will use the micro lens array on the same day and just stick with the Pico, and that's it. But some of these patients that come in may have read about the studies out of Harvard, Matt Avram's study, that really looked at cumulatively the patients that had thulium treatments not only had less sun damage and pigmentation, but they had lower incidence of skin cancers. And we're starting to hear and see more of that. So integrating into what patient may have already planned in terms of doing a 1927 laser, and then very quickly on the fly being able to say, you know what, on these isolated spots of lentiginous that benign appearing, I use my dermatoscope, I'd like to, you know, do some Pico or Q switch 532 and really see if we can make those specific spots better along with your treatment. And this is for a patient who's in no, you know, big rush about things. They just want to see improvement, and they know in their mindset that they had already planned to do a series of thulium. So I wasn't really deviating from their plan for overall precancer treatment and hopefully minimizing the risk of non-melanoma skin cancer from that study, first author's Benson, that was published in Derm Surgery, but just adding hand Pico. And again, that turns on really quickly. Just pop them into that room. You put in the tip that you want to use, in this case, the 5mm 532, and going over those isolated spots. And then for the lighter spots that you can see, you know, in the smaller spots, using that 3mm. But we can see really nice improvement over the course of a few treatments with this patient. And then there's the patient in the next case where the patient was scheduled for a hybrid fractional treatment. And I said, look, you've got some isolated spots. I'd like to add the hand Pico here, the 532 I use to the isolated spots. And, you know, this is a month later. So some of these patients, they have a social event, they're ready to go. They're already planned on doing that. They have something scheduled. Somebody said, you know, whether it's their sister or somebody in scheduling said, oh, you know, it sounds like we would do a hybrid fractional here. And just being able to have the flexibility to add a laser that turns on very quickly, calibrates super quickly, add the tip that you want or a couple tips that you want, and seeing improvement that's part of a combination program like this is really nice to give patients results very quickly like this. So next slide, I'm going to turn things over to Dr. Campos. And Dr. Campos, I mean, we heard that she wrote literally a book on electromagnetic energy. So she understands. Give her the tough questions instead of me tonight, because the physics of this stuff, I think she understands better.
It's too late in Brazil. I'm getting falling asleep, you know. I'm too late for these questions. But Antonio just answered. I've been working with the hand Pico for 7 years, on my clinic 6, and I'm still like amazed by this technology. And I do use like for extra facial. Was difficult because they asked me to choose just 5 patient subjects, because I do have a lot outside for treated like legs, even like arms. But let's concentrate. This is a typical patient to teach like skin rejuvenation. So for those who don't get into all that downtime, don't want any risk. If I do want, like, what produce more collagen, I have to say that's not the Pico. The 3040, the Pro Deep, but it's more tricky. It's not so easy to work. I love both. So most of the time, like I use the Pico because the people don't want like that downtime. So this a patient before and after, she was treated like with 3 times aggressive treatment for aggressive where you think about the hand pico. So this is before and after 3 treatments. This is what expected. This is not my best case. I decided to show you one regular case. So for rejuvenation. Who never caused a post-inflammatory hyperpigmentation? This patient was treated by the TCA here on the face to remove something and got hyperpigmentation. So this is the patient, 30 days after one case of the treatment. You might ask, Valerie, why did instead of, if you think it, when you want to like remove like pigment, use the collimated, the 7 mm. You might ask, why did you use the fractional? The fractional is when you want more concentrate, the lyobis, you want more collagen. Because I caused this. I'm not gonna lie, say that was my neighbor. No, I did this. So I got the treatment to remove, and I said, okay, I have good news for you. I'm gonna give something for you to look younger. And guess what? She liked it so much that like she paid for a new treatment just to have rejuvenation using the Picosecond, and did not stay. She's still my patient now. She wasn't too mad to me, maybe thanks to the fractional. This is a beautiful story. This guy works when I go to the gym. He's the guy on the like the door, gives like some paper. And one day he said like he was like not had like a trauma because of this lesion, because people used to say for him that he was dirty on his face. So this is the patient, like after 3 treatments. This is like 3 months after 30 treatment, much better, and he's so happy. And I have to say that I will keep treating him for free. He's a nice guy. But look at here, if you can realize the results. Ah, no, she removed.
Oh, no, go back. Okay, sorry.
Yeah, no, because like there was like one huge uh, slide showing the improvement in the skin texture. I didn't do biopsy. If you ask, this is a melasma, I don't think it's a melasma. But like after 3 treatments, the guy looks much more self-confident and much happy. This is another patient. And something that I like, and I have to say that like I'm the board of the SkinCeuticals, and I like to associate. And after the procedure, like my favorite like molecule is the vitamin C. And I do like the vitamin C from SkinCeuticals. Here for this patient, I associate the fluoretine. This is the secretary of where I go for my ophthalmology. And I look at her, she wasn't happy, and even problem with in her marriage. So I gave her like this treatment here and after, and I associated at home the discoloration and the phytocorrective. For those who have dark skin type, yes, Picosecond is very safe, including for dark skin type. It's not that you can use just in dark skin type, of course. And here what I do, like I know this is different than what you get it, like for Vidance, they treated like skin type 1 to 4. I do treat it like in the more gentle and up to skin type 6. And even the intense pico, I do treat until skin type 5. But I do have like some secrets, and I'd like to share with you this publication that recently, okay, this publication that was like brand new from January, my friends and we put together is kind of algorithm in order to treat patient with skin of color. And I invited, because I'm going to talk a little bit about this and the AD, about this integrated skincare. Things that, like the vitamin C, I said, even orally, I do give for this patient some antioxidant. And before the procedure and after, to make the procedure more efficient and less painful sometimes for the patient. And last but not least, the association. I do like to associate, of course, if you just have the hand pico, yes, it's a good one for you to start. But if you have the opportunity to have the other hand pieces, you are going to have better results association. And why, Mike, the results are better? And then you don't need too much energy. And even using like 5 different hand pieces, it's safer and more effective. So I started by using the 1064, like the heat, the 515 hand piece, that it's very easy to use. So most of the time, I'm not the one who do this. I have someone from the staff that's not a physician, because it is very easy. And of course you can do, but I don't. IPL, when I'm doing rejuvenation, I use the 695 filters just to make the collagen. And this, I don't use it. Most of the time, I jump when it starts like the picosecond, because, and I can do a more aggressive or less. And that like use the Pro Deep. I don't use the whole face, but when I want more collagen, sometimes around here, the eyes or the mouth when you have wrinkles, or the Pro Deep, it's excellent if you are treating acne. The results are spectacular. And I found always the last one I like to use is the 200, the Duo, the Arabian, because I don't use too aggressive, but I do like, I call here like a rain of laser, just something very mild, because then I use the drug delivery. Usually I finish, as I said before, with vitamin C. And I guarantee that if you use that, you are gonna like, and maybe you do have like, I don't have much time, because like, but maybe I do another time, I show more results using the five hand pieces.
And to
And
clarify, you like using this all in the same setting, all in the
Yes.
same treatment.
all
Yeah.
the same setting. Yes. And I'm leaving here my contacts for those who wanna be, and I could discuss a little bit more. The easiest way is through the Instagram. Thank you very much.
Thank you, Dr. Campos. Okay.
And then Dr. Gardenia Palomino is going to join us and talk about her experience over the past couple of years. But I just want to echo something Dr. Campos said about the 1340 and acne. You know, a lot of times people come in, they have some areas of inflammatory acne, and that 1340, you know, at like 60 millijoules, you can really help those spots decrease the erythema and the inflammation. That's a huge win. And then, you know, scars. We talked about the hemosiderin before when I was showing those areas behind in the popliteal fossa, but using that 1340 for scars as well is really helpful. Very efficient treatment. It's fast and very effective. So having these types of technologies where we can integrate those hand pieces in and out, the hand pico and the Pro Deep are screw into the same areas, but it's quick to change over. And I always keep the long pulse Nd:YAG, the 1064 laser, plugged in the other port, because that's what I'm using for these alar vessels. And sometimes patients have a venous lake, or sometimes they'll have large temple vessels that we can treat those as well. So having the flexibility on the Xi platform for me to do all the things that Dr. Campos said has been really fun and effective. Same platform, plug it in, have all these things to use. So Dr. Palomino, let's hear about your experience.
I have to agree. My favorite combination is Pro Deep with hand pico. And I can't believe it was my last hand piece. I bought Pro Deep. It was my last hand piece, and today is my favorite combination. And I think talking about hand pico, the key points are downtime. It's really important today, and the phototype, because we aren't afraid about the phototype after hand pico. And I want to show my first case and talking about a story. I want to tell Dr. Valeria Campos. A year ago, I went to a congress and I asked her about the fluency in high phototype. And she told me, I use the maximum. I use the maximum. Don't be afraid. And I'm not afraid anymore. And I brought this case to show her because it's a patient with 25 years old with a high skin phototype, not so high as your case, but a high skin phototype, who is getting married this month. And I usually combine Prodigy with hand pico, but for this case, I thought hand pico should be enough, and I was right, as you can see. So I did 4 sessions, and I tried to use the maximum. I don't use the maximum the first session because of the patient, but I'm totally comfortable with this. So I wanted to show you this case because it's special. It's only with hand pico, the fractional spot. And it's your case, Dr. Valeria. My second case is a case about melasma, but when the patient had the final treatment, the first thing she noticed about was the pores. And I brought this photo to show you and to invite you to observe when you start to treat with fractional spot, the pores, the skin quality of your patients treating melasma. When you use the fractional spot, you always see the improve of the skin quality, and this is obvious. The melasma improved, but the pores reduced a lot. So I brought this case to show you the change of skin quality when you start to use the fractional spot, even when you treat melasma. I always treat with the fractional spot when I treat melasma. I do a session per month, but I normally indicate 6 sessions in the full treatment. And my last patient is 43 years old. She's a psychologist, and she wanted to treat the wrinkles around the eyes. So this is a case of rejuvenation of this area, and she didn't want to stop working, and I didn't have Prodip in this case. So I just used hand pico to treat this area, and I saw this beautiful result, as you can see. For these lines, it's really amazing just after 3 sessions. And these are my contacts. Thank you so much.
Beautiful results. So with the 6mm MLA, the fractional handpiece, I always find that, when you said you use the maximum, that second patient, the periocular area where you were doing 1,000 pulses, that was at 2.5 range, which for me is always purpura. It's always going to last
Yes.
days or so. And then that other patient with the post-inflammatory hyperpigmentation, you were at like the 1.75 joules area. So I always feel like I don't start to see the more significant purpura until 2.25. So when you're treating these patients, how do you really talk to them about the downtime? How do you configure those settings, and how many days do you tell them it's going to be? Because that was a beautiful result under the eyes.
Yes. We talked a lot about the downtime. I told her about 7 days. I told her, okay, you can wear makeup, but I expect this purpura disappears after 7 days. And she agreed, and we started the treatment. But I use high fluencies even when I treat this area. I don't care about the purpura.
So, and I want to go back to a point that Robin made about the laser-induced optical breakdown, creating inflammation, but not heat. Because one of the most common questions I get, especially in the periocular area, is what is this pico laser going to do to my HA fillers that have been placed and really nicely placed? And I think it's really helpful to have a couple references in our armamentarium. And there's an article by Kim in Lasers in Medicine and Surgery in 2020 that I always refer back to, where the pico was done instantaneous right after filler was placed. And there was no change in the filler, and there was no change in the appearance of where the filler was placed or around that area. So I think it's nice to be able to tell patients that, due to the lack of heat and the laser-induced optical breakdown and the way that this mechanism of action works, we're not expecting to see changes in filler at all from this. And then they feel better, because many of these patients in the infraorbital area, they do need volume replacement. Sometimes they'll start with that and then they'll do laser afterwards. And I think it's just good to have an answer for them. All right, so we're going to go to a couple cases. So Dr. Campos, this is a tattoo. You can see, primarily, blue, black, green kind of color that we would approach with the Pico 1064, but a little bit of red back there too. How would you approach this patient? Talk to him about the overall regimen that you're going to recommend for them.
Excellent question. It's I don't know if you remember, because like when the Picosecond was launched, I remember it was like a color blinded laser. We could treat all the tattoo colors. Here it's okay, like we can get rid of if there is red and black, but it's still like the yellow, the white, the blue. We cannot get rid of that, even using like a picosecond. So what I tell my patient, I never promise I'm gonna get rid of 100% of the pigment, except if it's very like a simple tattoo, that the one you show that was like that amateur tattoo. So what I say, do you wanna like me to remove the more I can and you do another tattoo on top of it? Okay. Otherwise, I don't promise. And what I do, like I do have like something that I learned with Rox Anderson, was like after the procedure, I do my picosecond laser. I started using like nanosecond, picosecond. Sometimes the beginning I do that technique that was waiting like in the same section. It's like you wait 20 minutes to do again when like the tattoo, like because the beginning you have the whitening of the tattoo, so wait for 20 minutes and you do again. And then on top of it, I do the the duo, the erbium laser, and you can use like something like to make it pills, because the tattoo is removed by the phagocytosis, and even for some part of the inks that are gonna be like eliminated to make the treatment more efficient. But I always like it. Take home message, it's always difficult to treat like multiple scholars tattoo. I don't know if I answer, I talk too much.
No.
Wow, great job. You could promise.
So Dr. Palomino, your experience with tattoo like this, and obviously this is an amazing result, and, making sure patients realize that, 7 treatments is not a lot of treatments to see, pretty spectacular improvement like this.
Yes, it's an amazing case. Absolutely. I don't promise. Don't promise, because you'll be in trouble. And I talk with my patients about at least 6 sessions, and we discuss during the treatment if you need more sessions or not.
So the point Dr. Campos made about integrating, a fractional erbium is so important. And I think that when people have what we call in the US like road rash, or really a gravel tattooing, they fall off their bicycle, those are the patients that I very commonly will integrate a fractional ablative technology like fractional erbium, which we have the flexibility to do. With the dual is really helpful. I have a paper that's just about to come out in the Journal of Dermatologic Surgery about a guy who had road rash from a fall on his forehead, and really by using Pico, Q-switch, and fractional erbium being able to help clear this, because those are really tough because they're at multiple different levels when they have that abrasion to the skin. So great result here. Can we look at the next slide? So I think this is Dr. Campos's result, patient. So, and if you want to talk about, this is a really significant case of melasma. As dermatologists, we're always recommending extreme sun protection and really being good about things. And you can see that, she probably wears a hat, but probably doesn't do very much other than wears a hat. Her forehead doesn't look too bad, but the lower face suggests that she's getting a lot of sun exposure, whether it's biking or skiing or whatever it is. Her forehead is somewhat covered
She's
up.
a runner.
She's a runner?
Right. Yeah.
So, this is tough. We have a long conversation to have with people about what are effective sunscreens, protecting against UVA, making sure sunscreen has a tint for iron oxide and high energy visible light. Some of the things that, people have found that may be more effective than others, and then a whole discussion about tranexamic acid. But then, we have the technology to use something that doesn't create a lot of heat, and we can try to see improvement. And this is your case. I'll let you take over.
Yes, and what's like this is like a old like a patient that I do like to integrate it oral medication like tranexamic. This patient I didn't use tranexamic acid, but I do like orally polypodial leucotoma. I do pycnogenol for some patient. And what I notice is that it's not just about treating. You know that melasma is not just about the pigment. And there's many new studies showing, yes, there is like on the areas where there is melasma, the skin is older. So you have to use your Fractional in order to make the skin better. The results are much better when you associate it. So I do always use the 7 millimeter because the distribution is better. And you do the 6 millimeter in order to make this skin like more younger, and the results are much better. But another thing, you need to tell your patient you are not cured. It's like melasma is like the diabetes of the skin. So the patient needs to have like maintenance. So after the summer in Brazil, the heat can make the melasma worse. So you have to tell them that they have to come every year. But how do I convince them to spend this money? Telling them that they come to treat the melasma and you are keeping their skin younger. So they come every year, get a new section of lasers like dye hair or anything. Come back and have a new section of laser. But if you talk about it, explain, if you don't use like the sunscreen property, you are going to spend more money here. My consultation, I even talk about the diet of them. It's more than an hour. It's a very difficult like consultation, but when you have a good relationship, the results are excellent and the patients are happier.
And if you go back there, when you're using like 7 millimeter, there's kind of a delicate balance. When I get to 0.8, 0.9, 1.0, you start to see like a little hint of just sort of a pink color there. So you're going over it with the 7 millimeter first, and then I usually use the 6 millimeter micro lens array in the area adjacent to the melasma, just so I could see where just be again subpurpuric, and then integrate that. But I think it was Basil Hantish that published in JAMA Dermatology a number of years ago that really, by fractional approach to the melasma, just breaking up some of the pigment, you can help function on a different level. It's not just the LIOBs, it's really just mechanically breaking these areas up with the fractional technology.
Even make more collagen. The studies show that when we increase the collagen, the results are better. So yes, the 6 millimeter makes all the difference.
And then probably a bit of coagulation in there as well, because we all know that if we look really closely with a dermatoscope, we're going to see a vascular component here as well.
Yes, exactly.
All right, Dr. Palomino, this is, similar to your case, post-inflammatory hyperpigmentation. It looks like this patient has had some acne and is a picker, and it's probably type 4 skin. And this is what we see in many of our patients that come in. And you can be a great dermatologist and treat their acne, and they're not having new lesions, right? But they come in and they say, well, I still have acne, you're not helping me, and you point out that these aren't primary lesions, these are secondary lesions, and we really need to treat the discoloration, right?
Right. And I think we should discuss one thing, because a lot of people think about Pico as an evolution of achroma, and the fractional spot is the game changer. It's the key between the both. And in this case, I start with the 7 millimeter spot. I try to use the 5 millimeter spot too, and I combine with the fractional spot, because I think this is the big difference between achroma and hand pico. Because when you treat the skin quality, you improve your results. And in this case, I try to use these three spots, the 7, 5, and the fractional spot.
And, and then sometimes the 3 millimeter 1064 too, just for these really small, that look really more like lentigines that these patients have in a couple spots as well. Like she's got the most medial aspect of her chin, but throwing, and probably the nasofacial sulcus as well. But I mean, sometimes we're using all 4 little tips of the 1064, right?
Right. I like the 532 too, but I try to begin with the collimated spots, the 1064 spots, and after I use the 532, but I try to begin with the 1064.
This is a great result, and I don't know if everybody caught that, but that was just one treatment you had there.
Yeah, it's a good result, absolutely.
So, and then this is a patient, whether you're chest or back or face, we see a lot of people, again, who've had IPL treatments in the past. And, with the ones that are more contrast, those are certainly much easier to pick out and to treat. But as you get into these lower contrast spots, it's really hard for an IPL device to be able to be really good and effective for those individual spots, which is where, when we come in with overall, being able to use hand Pico and having the Pico 532 and the 1064 and being able to treat different skin types and darker skin types with the 1064, we're able to really pick out these lower contrast lentigines, and it's a home run for our patients. So Dr. Campos, if you want to run through your approach to this patient that, clearly was 532 Pico was used and saw some really nice results. Again, this is one treatment.
Yes, this is the typical result. Exactly this. It's like use the different like hand pieces. Like sometimes people just keep using just the 7. You need to think that when you use the 3, it's the more concentrated energy, so it's more efficient when you want like a vaporize the lesion. Excellent result. And sometimes I do on the face. I do like you said, Joel. I do the same, like localize it with the 3, and then I use the 7, like on the whole face. Excellent result.
Palomino, I mean, this is a really tough patient. These patients come in, this patient, maybe the best answer for her is a facelift, but she came to you as a dermatologist and said, gosh, before I even consider some sort of lifting procedure, the pigment is really bothersome. So, the now that we have in the States since December, the MLA, the 6 millimeter fractional array. So this is a square. The other tips that we talked about for hand Pico are round, whether it's 532 or 1064. This square micro lens array that Robin showed, really the physics of how it gets in there and induces the LIOBs with really some inflammation, but not heat. And being able to break up the pigmentation, target the pigmentation, and see really nice improvement, even a bit of neocollagenesis in a patient like this, I think you can win a lot of loyalty in this patient from that approach very quickly. So what would you do to approach this patient?
It's amazing. This is a case to use all the hand pieces. In this case, I combine Pro Dip and Hand Pico, and I use the maximum, just Dr. Valeria teached me. But I think here we should use at least 3 sessions, 1 session per month, and you can combine with the collimated spot to treat these pigmented lesions too.
Great
Joel,
result.
but you are talking about surgery. Here in Brazil, the most like some of the plastic surgeon, before doing the procedure, they refer the patient to us dermatology in order to make the skin better before doing the facelift. This is getting more and more common because they notice that when you do like a laser before, the procedure is better, like the healing is better. So even like sometimes like it doesn't mean that the patient are not going to the plastic surgeon, but we can work together.
You know, that's a bit risky for them because now with the 6 mm and giving them really good results like this, they might say, you know, I'm so happy with the way my skin looks. I don't think I want surgery anymore.
Yeah, this is the risk.
Yeah,
Yes.
I do want to point out that, you know, it's really challenging to take pictures that are consistent. And by no means do we want to suggest that this improvement in laxity was just the laser. I think if you look at the positioning of the nose in the post photo after 3 treatments is tilted up a little bit, which probably affects the jowling. So, you know, probably the best thing to focus on here is really the improvement in pigment that's quite significant. And then you can see around the eyes and around the mouth, not only the improvement in uniformity of the pigment, but also probably from that new collagen formation, some improvement in the lines and the wrinkles and a little bit of laxity in that area too.
Yeah.
And
So, and then, you know, nevus of Oda is something really challenging. And, you know, I think with the introduction of pico lasers several years ago, this really has allowed us to treat these patients even further. I think Q-switch gets to a point, and as Robin showed, that you really the particle breakdown and being able to break down the pigment even further. But having pico in a practice is a feather in our cap because we can use that pico 1064 to get better results than somebody who's just using a Q-switched type of modality, and to really get to a point where, you know, we never promise that we're going to make these clear, and certainly never promise that they're going to clear and maintain, you know, that improvement, because some of these do tend to come back a bit. But having the ability to treat these and change people's lives in many cases for something that they could spend hours on every morning camouflaging a nevus of Oda, and all of a sudden they get to a point where they might not have to put anything on, and they've been doing, you know, that counting in for waking up early and camouflage for a long time. And I will tell people it's very easy to put an intraocular shield in. You just need, you know, proparacaine anesthetic drops. You put an eye lubricant, a sterile lubricant. You pop in the stainless steel shield, and you're ready to treat this patient. But it is important to have a shield in there. So, Dr. Campos, talk to us about your protocol and how you talk to a patient with nevus of Oda that was referred to you.
Like what I say, like what I say usually for my patient, we can be like less aggressive, less downtime, but you're going to spend more money. And I do like to use like high energy. And I totally agree with the protection of the eyes. And I do have like I have someone work with me, and the time that I'm gonna use it, because sometimes the patient can close and be difficult. And I look at the one with me, like the usually it's not like a physician, but someone. And I do have like the air cooling. And the time I'm gonna put inside the eyes, she use the air, so the patient get like a, I don't know, she doesn't pay attention, and I open easily and use the internal eye shield. The protocol is similar to you, like I never say like the number of sections it's going. Again, I never promise I'm gonna get rid of 100%. Levels of OTA can be tricky and a little bit difficult to treat. But you know what? Sometimes for the majority of the patient, just to be able to cover easily with makeup, they get very happy. And it's not something that they complain I like a lot. I like to treat nevus of OTA. But is it tricky?
So that's Dr. Filippo's patient, but you can see that that's like a outstanding result, starting with the 5 mm in the first through the fifth session,
Yeah.
then being able to, you know, I think a lot of times you get to a point where there's so little pigment that, you know, you really need that 3 mm spot size to be a little bit more aggressive so that you can actually see that white frost. And then we just sort of taper up the treatment till you see that white frost. And treating this, you know, with the 3 mm is pretty slow. But nevertheless, you know, after several treatments, in this case, starting on the 6th treatment, you really need that 3 mm instead of the 5 to be able to get to those energies. But I always try to integrate at the end of it that 7 mm 1064 too, just to come across the whole area. And with the micro lens array, you know, just breaking up some pigment there too, can be really helpful, and I'm starting to do with a nevus Savota patient that I have as well. So 10 treatments here, outstanding result from Dr. Filippo.
Okay.
So we're right at the hour mark, and we appreciate everybody joining us. It is very late for Dr. Campos and Palomino in Brazil, but Robin does have some questions from some people, and if you want to stay online for a few more minutes, maybe we can tackle a few questions for some folks out there. But thank you very much, everybody, for joining us. And I think it's exciting to have the Vidance technology in the 3 of our practices. And we talked about how we use specifically hand pico, but a little bit about some of the other hand pieces that have been helpful, like ProDeep 1340.
Yes, so we do have a couple of questions in the chat, and we do have a comment that this has been a great presentation. So I wanted to start with that and just say thank you so much to our doctors. Our attendees are really appreciating this. One question was, in cases where ProDeep and Hand Pico are combined in the same session, what happens first to the skin, I'm assuming, and what parameters for rejuvenation would you use?
I do use the picosecond before, but it's not that important considering like you are talking about different chromophores. So if you're using the pico, like your main target, main chromophore is the melanin. And if you're talking about the ProDeep, then the chromophore, it is the water. So you can mix it. It's okay.
Typically, a great example for this would, when we use both of these, would be somebody who has both acne and they have post-inflammatory hyperpigmentation, and they may have, rolling acne scars as well. So I typically will use the Pico first, because what happens with the ProDeep is that you usually get a little bit of erythema there, and I don't want to pick all that up with the Pico. So I think, oftentimes it's actually different lesions that we're treating, and I don't tend to stack them that much. I might use the micro lens array with the Pico on a specific area of post-inflammatory hyperpigmentation, and that'll also improve the scarring from that standpoint as well.
And another question about combining treatments. There's a question about combining a collimated tip and then layering the fractionated tip on top. And we talked about what happens to the skin when the fractionated tip is used, but someone was wondering what happens when the collimated tip is used first. What does the skin look like? And then what happens when you add the fractionated on top of that?
Well, that's usually the sequence that I do. And you do see a little bit of erythema there. And then, when you add the MLA on top of it, the fractional piece, that's the point where in the adjacent skin, I like to see what the subpurpuric setting is before I go into that specific area that's already a little erythematous.
Okay. And then a question about, I want to ask Dr. Campos is, can you talk about the settings to use Hand Pico with ProDeep in the same setting for acne scars? So what are the settings that you're using when you're using the MLA combined with the ProDeep? How high do you go with your energy?
The highest, of course, it depends on the skin type you are treating, but I like to use like, especially if the pico, I go like, except if you are treating like skin type 5 and 6, and you didn't prepare your patient using like an antioxidant, like decrease the, because the key here for don't, let's thinking the most common side effects here with this kind of machine, it's not scar, it's not hypopigmentation how to used to have on the past. Nowadays it's the post-inflammatory hyperpigmentation that usually is a consequence of the inflammation. So it's not that you need like the knockdown, because we do need some inflammation. Because if you see the paper that you read, and even what I talk, we are not talking about using cortisone also. So it's a modulation of the inflammation, and then you use high energy, and like even localize on the scar. I do use it 120 with the ProDeep. That is a lot of energy, but the results are spectacular.
Does anybody have anything to add to that one about hand pico and pro deep at the same time for acne scars in terms of your settings that you like to use?
So oftentimes, I think 90 millijoules is sufficient on the Pro Deep, at least in my hands, for some of the areas of scars. And then, really just titrating up that micro lens array, as I talked about, typically, you're at 2.5 or so before you start to get purpura. I think at 2.75 and 3, everybody's going to have purpura. So having a conversation with them about downtime and what things are going to look like is important, because it can take a little bit of time for that purpura to settle down. 3-4 days is very common.
Do you know what, Joel? When I talk to my patient, I say the purpura is the plasma. It's not that plasma. It's the plasma that it's going to form inside your skin. And, it's not a convince. I really believe, but I explain what does it mean, the purpura. It's not like, because usually purpura, the patient think it's like a mistake or simple like a chemos. I say, no, this is like the laser work on our skin. And they keep they like it. When I say, yes, I do have it, what you said, I it's not a waste time, but I take some time to explain them for them to accept it, even like the purpura.
And
I
I
say the
think,
more purpura, the better are gonna be the results. And they trust me. And they
Yep.
do have good results.
There are patients out there who honestly feel no downtime, no result, right?
Yeah.
I say
yeah,
no
and
pain, no gain. I tell them, I say, no, it's not that no pain, no gain. I say them, do you wanna spend more money, come more here, or you want more aggressive? And they decided. And I take notes, because if they complain, said, you said that you have a party and you wanted to do more, in this way, I have good relationship with my patients.
And I think that when you compare the downtime of an erbium or CO2, which are aggressive treatments, with hand pico, you can be aggressive without that downtime. You can tell your patient, you can go home now and take a shower. You won't feel anything. And this is amazing, because you can go strong and you won't have an important downtime. I think this is the key, because the patient feels only during the session. After, just purpura, you can cover with makeup, then that's all.
Great. And I think these new sunscreens that offer a cover up have been really effective in having that tint for the high energy visible light. So this has been a great session. Thank you all for joining us. We have our head of the US, Carter Morgan, who's here and is going to talk to you a little bit about the sales team and people to get in touch with. Carter.
Thank you, Dr. Cohen. Good evening, all. Just a few quick points here. We'll be wrapping up. I am Carter Morgan. I'm Vice President of U.S. Sales for Vidance USA, and we are deeply grateful for all of you for joining us tonight and then watching on our link afterwards. Huge thanks to Dr. Cohen, Dr. Campos, and Dr. Gardenia for their insight on treatment of interesting cases and skin conditions with our revolutionary hand pico. I mean, truly remarkable results with tattoo. Dr. Campos, your melasma was spectacular. So thank you all. As you can see, and most of you know, Vidance is a global company with thousands of systems with leading doctors all over the world. You've heard from our panel tonight how versatile our lasers are, with no calibration time, no consumables, plug and play in a single session for all skin types all year long. All the things that work in Brazil obviously work here in the US too. Our multi-platform lasers are manufactured in Brazil's Silicon Valley, but now we are a wholly owned subsidiary here in the US with direct sales, clinical, and support operations, with finished goods and spare parts based out of our headquarters in Tampa, Florida. We've had a very successful launch here in America over the last year, with very happy core and non-core physicians, as well as some great med spas using our technology from New Jersey all the way out to Southern California. So we have some wonderful specials here in March. Here in the first quarter, we have a try before you buy program, as well as some other internal financing and some great leasing options. So please reach out to us on this link or social media with any questions, and we'll have one of our highly trained area sales managers listen to your needs and find the right Vidance solution for you. So again, we know it's late for a lot of you. We greatly appreciate you coming in tonight, and have a great evening.